Hi everyone, and welcome to Allen County Health Department's Diabetes Drops, our short educational videos to help with diabetes management. Today, we'll be doing an overview of diabetes distress and action planning. Diabetes distress is not a diabetic complication. It describes the emotional issues or pain that would be expected in someone who has a chronic disease. The burden of everyday diabetes management and care, such as eating, activity, medications, blood sugar monitoring, can be very overwhelming. Everyone suffers from diabetes distress sometimes. It's when it becomes too frequent or not manageable and starts to interfere in day-to-day life that you will want to seek support and talk with your healthcare provider. Diabetes distress is common and affects 1 in 5 people. It's different than regular depression. However, someone suffering from diabetes distress can also have symptoms of depression. Greater diabetes distress is associated with poor diabetes self-management, increased A1C levels, and impaired general emotional well-being. If you think you have diabetes distress, talk with your diabetic educator. They may be able to ask questions that help you understand what is most difficult for you and help create strategies to lessen your burdens. Accept that you can't control everything. No one gets diabetes perfect, and that's okay. Set reasonable health goals. It's okay if you make mistakes with your diabetes. Practice self-compassion and care for yourself as you do others. Self-acceptance means embracing our own shortcomings as well as our strengths. We all need support in our lives, and especially when it comes to our diabetes. This support can come from a number of places: family, friends, healthcare providers, diabetic educators, church, or support groups. You can also call 988 for 24/7 emotional support. Reducing the risk of complications and getting a better control of blood sugars may require behavior change or goal setting. Action planning involves setting goals to successfully achieve something you want to accomplish. They can help provide direction and benchmarks for meeting those goals. Action planning starts with choosing a goal that's not too hard or too big. You want to start with slow, small steps. Take time to write down your action plan. Have a bigger goal at the end with reasonable benchmarks along the way. Choose a goal you have control over. Don't choose something that is not realistic or within your control. Make your goal a positive statement. Focus on what you will do, not what you won't. When choosing an action plan, start with SMART goals. SMART stands for specific, measurable, attainable, relevant, and time-bound. When you choose a goal, make sure to be specific. You want your goal to be clear and well-defined. You want to choose a goal that's measurable. Give yourself tangible benchmarks with beginning and end dates. Make sure the goal is attainable. Ask yourself, is this possible to reach? Is this something I have the ability to do? Make sure the goal is relevant and realistic. It should match what's important to you and your priorities. Make sure it's time-bound. Write down when you plan on starting your action plan and maybe even a goal date for when you will finish. Write down your goals and keep them in a place where you can see them often. Ask yourself, am I able to complete this goal? If you're unsure, you may want to edit your goal to something more realistic. Remember, you want to start with small steps. Did you give yourself enough time to reach your goal? You may not accomplish a goal in the time that you originally gave yourself, and that's okay. Some goals will take longer than others. Think about barriers in your life that might stop you from reaching your goals. Are there ways around these? Have a backup plan in case a barrier arises. For example, if your goal is to walk outside for 20 minutes every day, have a backup plan in case of bad weather. Is your goal written in a positive way? Are you focusing on the positives of behavior change instead of using negative language? Action plans are ongoing. When you accomplish one, write a new one that will help you reach your larger goal. After all, every action plan you accomplish is one more step to reaching your overall goal. If you have any questions or if you are interested about learning more about our diabetes or our diabetes prevention and control program, contact Allen County's Health Department at 270-237-4423 or go to our website at allencountych.com. Diabetes can be a complicated disease, but the good news is you don't have to fight it alone. We're here to support and help you. Give us a call today. Thank you for watching this video and take care.